Why is implementation research, IR, important for the health systems in low and middle income countries?
I think it's been a long exposure that has brought about the realization that for programs within low and middle income countries, most of the interventions are sourced from outside. And then they've just, brought that, this is a drug or this is a tool that can be used for one or two interventions. But then the local context has never been adequately addressed. And programs start off running with the intervention and trying to implement it. But then what has come at a cost in most cases is that it doesn't work the way it was expected to work. And therefore, this is the time that people say, oh, maybe it's because it's a different context. At times it's too late for many, people have either become affected permanently or even have passed on. But the point is that it comes at a cost that, okay, we have this intervention which worked elsewhere, in some cases in very controlled clinical trial setting, randomized controlled trials. But then when you put it on the ground, the context becomes very, very different. And then one is now starting to ask the question, why is it not working? And then the next one is, how can we make it work? And that's what implementation research is all about. And in most cases, this catches or appears to be a late thought in most interventions that, especially that end up in low and middle income countries.
Why is the IR not more widely used? What are some of the main obstacles?
From my experience is that it is an assumption that things will work as expected everywhere. So that assumption has costed, a lot of interventions to be regarded as not as effective as expected. So there is that assumption. And then, of course, there is the non-important placing of interventions based on the local population. They kind of are neglected. Their voices are not given preference or given importance. So that, from outside you bring an intervention, then it's supposed to work, it doesn't work. Then the point therefore that appears is that there is something at the local setting, be it the political situation, be it the environment, be it the actual population, the patients, their views or their understanding of the problem is not clearly given enough importance in terms of why things don't work the way they're expected to work.
Which skills are most crucial for effective outcomes in IR teams and why?
Lately, the definition of particular competencies that implementation research teams would need for them to successfully identify a problem, find a solution, and apply the solution. And for experience so far that some of them definitely could be more important than the others, but from my perspective, one of them is being able to put together an implementation research team in terms of individuals and in terms of institutions, because those skills can never be within one individual, neither can they be within one institution. So the ability of an implementation researcher to bring about the right stakeholders, be they individuals or institutions, makes a whole lot of difference between success and failure. So for my understanding of IR is that the beginning of sorting out of or resolving some of the issues is identifying the right stakeholders, because stakeholders seems to be the buzzword, but for me is individuals that house specific skills and institutions that are custodian of those skills, and therefore bringing them together, number one, to identify what the problem is. Then number two, to come up with a way to address the problem. And one of the other most important part about the team effort is that how do we now apply the solution we have found out within the health system? So if you fail to be able, or you don't have the skills or the competencies to assemble a team, then implementation research will always remain very academic, and it will not be driven by the right people for the right reason.
What are the benefits of IR self-assessment toolkit?
The self-assessment tool now, which is part of the IR toolkit, is an eye-opener. It gives the opportunity for the researcher as an individual or as a team to look at some of the main competencies that have been described as helping IR teams to work well, and then they gauge themselves, or an individual say, okay, I think I have never known that I need to know this, but I definitely, if I want to be an IR expert, I need to know it. Then it gives you that realization that there are things that you should know that you don't know, but also gives you the opportunity for you to track whether actually what you don't know, you are developing the skills with time, or your team is actually building up. So it is a tracking effort that tells you, hey, if you want to go from point A to point B, these are the requirements. Gauge yourself whether you have them now. Then you can track over time whether you are achieving your objective, or your team is building those competencies for them to be able to deliver successfully on implementation research. So it's a guidance and it's self-paced. You can take 24 hours to build skills. You can take 2 years, 2 months, but you know where you are, where you want to go. And then when you are challenged with the inability for you to do 1, 2, 3, is because you don't have a particular competence, then you have the motivation to go looking for that information and therefore be able to build that and become a successful. For us, is a tool that aids a better understanding of IR, team formation, and the acquisition of the appropriate competencies and applying them at different levels of the health system.
Who is the IR self-assessment toolkit suitable for?
Well, I think the tool as it's currently constituted is for everyone interested in IR, despite their level of understanding on competencies. So, for example, if somebody is doing a MOOC, which is like for us the awareness creation of implementation research within a health system, then they can still go and say, oh, I think all these ones I have never thought about them, but I would definitely try to do something. You have already created awareness that there are particular competencies required, even at the lowest level. Then if they have enough motivation, they will now say, okay, I need to start acquiring these skills. Similarly, if there is a senior expert on implementation research, they have always been doing implementation research, but then they have realized that maybe they have a challenge in handling ethics issues within implementation research. So they will say, okay, I think I need to build those skills within me or within my team so that whenever there is an issue on ethics in implementation research, I'm able to address it. Similarly, could be a very seasoned implementation researcher who has been doing for a long time, but they always find a challenge when they want to apply what their results, their findings are into the health system. Then they say, okay, then there must be something to do with the communication. So I need to build that skill that within implementation research, I need specific communication skills for that my results can be adequately communicated to the implementers. Be they at policy level or at implementation stage, I need those skills. And this is somebody I've been doing research for like a long time, but now based on this tool, you are made aware that maybe some of the things that have been going wrong is because this skill is either low, either not adequately applied, and that realization is eye-opening for the entire spectrum of implementation, from the beginners to the experts.